Okay, and we'll get started. So good morning, everyone. Welcome to the National Providers Networking Meeting. We are sponsored in part by Land 53 Local Area Network, which services Bloom, Bremen Ridge, and Thornton Townships. We're also able to provide this meeting due to part funds from Lions Clubs International Foundation. This is our monthly networking meeting where we come together with providers, starting with our main focus being the southern communities of Illinois, which is about 51 cities in south of Chicago. Our goal is to bring the community together around identifying strength-based programs, youth advocacy, improved access to educational and mental health resources, and increasing the use of evidence-based programs and supporting the development. As I mentioned, this meeting is going to be recorded, so I'm going to ask that you mute yourselves, and we will ask you if you want to unmute, and at a certain time, that's more than appropriate. But just as a general, just keep your microphones on mute to minimize the background noise. Because we do have a relatively small audience today, I would like to give everybody an opportunity to just go around the table. I'll call your name because I can see everybody's screen. And if you could just please just give us your elevator pitch, let us know who you are, what organization you're with, and a couple of sentences if you want to tell us about what you do. And I am going to stop my screen share, and I will start with Miss Jenkins.
Good morning, everybody. Thank you for having me here today, and thank you, Suzette, for inviting me. My name is Juanita Jenkins at Metropolitan Family Services. I am a behavioral health therapist under the R3 program. Thank you.
Thank you. And Christina?
Hi, everyone. Good morning. I'm Christina Ramirez, and I'm the Assistant Director of Business Development for Hartgrove Behavioral Health System and for Garfield Park Behavioral Hospital. Nice to see everybody. Hi, Mike.
Hi. Kelsey?
Good morning, everyone. My name is Kelsey Barnick, and I work with different lands throughout Cook County as a part of the Permanency Enhancement Project through DCFS. And it's great to see you all.
Good morning, Kelsey. April?
Good morning, everyone. April Tolbert, Senior Public Health Educator, Cook County Department of Public Health, in our Community Engagement and Health Education Department. Always happy to be here. And I also wanted to just shout out Miss Suzette's African fabric in the background. I'm loving it.
Yes, love it. Thank you, April.
Thank you.
Kristen?
Hi everybody, my name is Kristen. I'm representing my non-for-profit organization called Elementary CP and ADHD. We are under the umbrella of Family to Family.
Thank you, Kristen. And Mike?
Morning, everyone. I'm Mike Rudolph from River Edge. I'm the manager of business development. Thank you for having me on. Hello, Suzette, Christina, Kimberly. We all met last month. Glad to be here. Drive carefully this afternoon.
Thank you. Thank you, Mike. And Giovanna?
Good morning, everybody. I'm Giovanna Smith, DCFS Resource and Recruitment, and I have been assigned to working with this group for DCFS and Lands 53.
Thank you and welcome, Giovanna. We're happy to have you.
Thank you. I'm happy to be here.
Miss Kelly?
Good morning, everyone. I am Kelly Jones, Senior Health Educator with Cook County Health Department in the Community Engagement and Health Education Unit. April and I are teammates. It is a pleasure to see you all today.
Oh, thank you. Welcome, Kelly. April, we have to figure out a prize for people who bring a friend. Thank you for inviting Kelly. Miss Suzette?
Suzette Logan, and I am the mental health consultant for Land 53. Previously, I was in marketing at Streamwood Behavioral Health, and prior to that, I was the manager of a crisis intervention team in the Northwest suburbs. So welcome, everybody. I'm so glad that you are all here. And a shout out to my girl, Carla. Okay.
Thank you, Suzette. And Suzette has been doing a knock-up job with getting you all to the table. So she has been very, very instrumental. Thank you for everything that you do, Suzette. Tamiko.
Good morning, everyone. I am Tamiko Dockery. I'm the Specialty Programs Liaison for both Hartgrove Behavioral Health System and Garfield Park Behavioral Hospital. So good to see so many familiar faces.
Hi, Tamiko. Thank you for being with us today.
Thank you.
Dr. Young.
Good morning, everyone. How are you? Happy Thursday. I'm Dr. Young, Tamara Young. I'm the Director of Student Services at Lincoln Elementary School.
Thank you, Dr. Young. And Dr. Young has been a very instrumental partner in helping us to really work with our youth, understand their needs, and really kind of set the tone for us building this platform to bring you all together. So thank you so much, Dr. Young. Michelle. Michelle? Okay, we'll come back to Michelle. Hi, Gia.
Good morning. I'm Gia Washington, the Director of Community Education at Sertoma Center. So it's nice to see everyone this morning. I'm having some internet issues, so I have my camera off. But
you have your camera on.
I will have it off after the introduction because thank you. I need to reserve every little bit of it.
I hear you. Yeah.
Okay, happy to be here.
Carla. Carla.
I don't know where she's at, but I'm going to send her a text to see where she's at.
Hello, this is Carla.
Here. Hi, Carla.
Hi, how are you? Yeah, I was invited by Suzette. My name is Carla Curtis. I am a LCPC in private practice in Bloomingdale, Illinois. I work with adults going through various life transitions and dealing with depression and anxiety and low self-esteem, etc. And I'm glad to be here.
Thank you, Carla. And I see Michelle was, you want to try it again, Michelle? Your microphone symbol says mute.
It's that, can you hear me?
Yes, we can.
Okay, it wasn't muted on my end before. I don't know what happened. I'm like, I'm talking, so like I muted.
You know what? It seems like you were frozen because I was like, she's got a really cool profile picture because it looked like a picture.
Yeah, so there you go. No, but I'm Michelle Wimberly and I work at River Edge Hospital and Streamwood Hospital. I work with Mike. And so I thank Suzette for making sure that I had the information to log on today. I really, really appreciate it. So thank you.
Thank you so much. I'm so glad that you all are here. My name is Kimberly Haynes. I'm the chair for Land 53 Local Area Network. And we are engaged in a partnership with the Illinois Department of Children and Family Services through their Permanency Enhancement Project. And we are really working to bring the community together to look at how we can organize and leverage the resources that we have within our service area to strengthen the families to prevent children from going into foster care. And for those children that do find themselves in the system, you know, working with the department to figure out how the community can support bringing those children back home. I'm also a staff member with Lions Clubs International Foundation. I manage a couple of our grant programs that support evidence-based social and emotional learning in the school system. So we are providing some additional support to this group in terms of organizational development, program capacity building, and really just trying to see how our foundation can support, bringing this group to a capacity where there can be opportunities to leverage all of the support that you guys are offering to lobby for local, state, or federal funding to support some of the work that you're doing. Our interest in this is really seeing an increase in number of available after-school programs, any programs that are servicing the youth. One of the things that we looked at early on as we were working with Dr. Young in her school district was really realizing, and it was really exacerbated by COVID, that there really aren't a lot of community-based services out here. Transportation has been an issue for this community for a long time. In terms of getting people into services. And right now we do recognize that there are a lot of clinical services. We're really grateful for the support that we've been able to see through the hospital systems and other behavioral healthcare structures. We're hoping to bring more of our park districts, more of our municipalities to the table to see how we can maybe work together to provide more of these community-based services. And we are interested in serving not only children, but also families as well. So part of the things that we do try to look for opportunities to offer are, anything that we can do to promote the use of evidence-based strategies, whether that is supporting training or providing resources to bring the community together to hear presentations like the ones we're going to hear today. So we do have a couple of committees through the land. We do have a working steering committee that meets a couple of times a week, and that committee really kind of sets the tone for what we do each month. We have been looking at ways that we can really, what is it that we can do as a land to support some of our shared efforts in terms of improving youth outcomes. We've also offered free training for our Lions Quest curriculum. It is evidence-based. It is available for students in grades K through 12, and we've been offering that at no charge. So if you know of any schools that may be interested in learning more about this program, or after-school programs who may be interested in using our program as a resource to have an evidence-based program in their catalog of resources. We are very happy to work with the University of Illinois at Chicago, the Jane Addams School of Social Work that provides us their support through Kelsey Barnick, who you'll hear from a little bit later on this afternoon, in terms of their support in looking at data, strategizing, being able to get connected with the other lands that Kelsey works with throughout the state. So I do hope that as we continue to meet monthly and we're sharing your information, that you guys will see additional people coming to your programs through the community, and maybe even have an opportunity to look at how we might be able to bring some of those programs a little bit closer to the communities. So thank you all again for coming. Thank you so much, Suzette and Dr. Young and Kelsey, for really helping to get us to this point. I'm so appreciative of your help. And without further ado, we're going to get right into our program. And I would like to take this time to first introduce you all to, we've got two speakers today. Let me get that together. I don't need to share everything. So we've got a couple of speakers today, and thank you, Suzette, for finding these wonderful speakers. I know we've worked with Tamiko and Christina before. They've done some fabulous presentations for us on trauma and PTSD. I think that was during National Mental Health Awareness or National Prevention Week. So we're very happy to have them back today from the Hartgrove Behavioral Healthcare System. So I would like to, without further ado, give you all the floor to begin your presentation. You should have freedom to share your screens.
All right, are we good? Can you see?
Yes, we can see, Christina.
All right, so I just had these slides over for a recent quarterly that we were doing, so I thought I'd bring them on over. So Hartgrove Hospital is what we'll start with. We'll provide a brief overview on both systems. I'll do Hartgrove, and Tamika will do an overview on Garfield. So you'll see that we have 160 beds dedicated to psychiatric care. It's our emergency services department is available 24/7, and walk-ins are welcome. We have our services broken down into a children's program for ages 3 to 9, pre-adolescents, an adolescent program, and adult program for 18 and up. Our units are deconstructed to include crisis stabilization and recovery. So on the recovery unit, you'll find those individuals who are struggling more with internalizing behavior, like depression, self-mutilating, maybe it's a first-time hospitalization. While on the crisis stabilization unit, you'll find those that are struggling more with externalizing behaviors like psychosis or oppositional defiance, aggression. So the programming is different, the staff to client ratio is different, and everybody's really to focus on what brought them there. Here you'll see a couple of pictures of our half gym, our reception area, and our PHP. And then we are home to the trauma program. It was recognized by the Joint Commission and given the gold seal of approval for disease-specific certification in trauma-informed care. And it's a 3-tier system that begins at the time of assessment with a TISCA, a trauma-informed system of care assessment, which is a live document that follows them throughout their treatment and gets built upon at each stage. So like that, when they come back to their regular outpatient provider, you're able to pick up where we left off, allowing for continuity of care to really place. It's based on 4 modules: anxiety management, affect recognition, cognitive coping, and self-esteem. And it's available for all ages. Here's some of the evidence-based approaches that we utilize at Hartgrove. And it's also a lot of the evidence-based approaches that are used at Garfield, which is a good segue for Tamika to take over.
Thank you. So Garfield Park Behavioral Hospital also has a full continuum of care with our emergency services, inpatient services, outpatient, and our individual group and family therapy. Let Christina go to the next slide. Okay, so here's some pictures of our facility, our day room, our waiting room. The picture before was the outside. So Garfield Park Hospital serves children and adolescents 3 to 17 years old. We're an 88-bed facility. And so we have several specialty programs. We have our Worthy program, which is an acute inpatient program for those adolescents who are at risk of being sex trafficked or who have already been sex trafficked. And so our social workers created that program because we were seeing quite a few of these kids in our emergency room. We do a 45-question assessment and, look at certain risk factors and certain warning signs for that program. So, homelessness, chronic running away, a young person that's involved with a much older partner, boyfriend, or girlfriend, maybe having large amounts of cash or multiple cell phones, things like that. A lot of times survivors present for treatment following a sexual assault, a drug overdose, pregnancy, or psychiatric condition. And this is basically like a 7-module program. So we spend a lot of time with our young people focusing on, staying safe and educating them on sex trafficking, helping them to recognize risky behaviors, helping them to learn about healthy relationships. We also partner with other organizations. So we do work with Chicago PD. If a kid has been brought across state lines, we work with the FBI. And if it's unsafe for them to return back to the home environment they were in, we work with an organization called Reclaim 13. Our next program is called Polaris, which is our LGBTQ adolescent inpatient unit. And so this is our inpatient psych unit for sexual and gender minority youth between the ages of 12 to 17. We launched this program May of 2018, and this came out of feedback and conversation that we were having with people in the community, mostly Chicago public schools. And so what we did was develop this 18-bed inpatient unit for those adolescents. And what's really important is that we did a survey and we found out that a lot of youth had had very negative experiences in a hospital setting. And so they would complain that hospital staff would misgender them, or that the staff didn't care to understand if their presenting problem was somehow related to their sexual orientation or gender identity. So we wanted to remove those barriers. So regardless of, the name that the person was given at birth, whatever name they want to be called is what we call them. We refer to the pronouns that they ask us to refer to. That name that they have chosen is the name that's on their, ID wristband in the hospital. And there are 5 key areas that we focus on during treatment. So bullying, trauma, discrimination, hopelessness, and family discord. Our last program is the YES program, Youth Exhibiting Sexualized Symptoms. And so this program is for pediatric and adolescents who display sexually problematic behaviors. And you can find out more about these programs on Garfield Park Hospital's website. This is just a list of some of our academic affiliations, our medical students and residents. And this is a comprehensive list of where we get our nursing students, medical students, social work students. And same thing for Garfield Park. These are affiliations. Okay, so both hospitals has a partial hospitalization program known as PHP, as well as our IOP for children and adolescents between the ages of 5 to 17. It's an in-person program, and if you call our intake department and mention that maybe if transportation is a barrier, we don't want that to be a barrier, so we can arrange transportation services. And then our adolescent IOP program is for children 12 to 17 years old, and we have one coming soon to Garfield Park. Here's our information about our outpatient services. So we have 2 locations, our Chatham Family Counseling Center at 1111 East 87th Street, which is on the south side of Chicago. And then we also have our Oak Park Counseling Center at 101 Madison Street in Oak Park, Illinois. But this is where we can refer out to patients or families, for individual or family or couples therapy, as well as medication management. And we do offer virtual services. And here's a list of our school-based counseling centers. So these are outpatient services that are available to students and their families. And these are our school partners. Okay, we also have telepsychiatry services. So this is certainly a safe virtual alternative. And so these are the phone numbers if you want to take a picture of it, or we can provide it in the chat for you. So there's Oak Park Counseling Center as well as Chatham Family Counseling. So you can call either number to schedule an appointment. And this is Daisy, our Educational Clinical Services Coordinator, and she does our professional development trainings and parent workshops at no cost. And this is in person as well as via Zoom. And so here's a partial list of topics. Her email address is daisy.gomez@uhsinc.com. And also her cell phone number is here. If you would like to contact her about a potential development or training. And so every 3rd Friday of the month, we have what's called our CCC, Coffee Conversation of CEUs. And so we have one for the month of February. We have February 18th, 2022. We are going to be talking about human trafficking across genders and systems with Dr. Keisha Roberts-Tabb. She is the human trafficking, gender responsive LGBTQ specialist for Cook County Juvenile Court. And if you would like to participate on the 18th, please let us know. We'll be happy to get you registered and send out the link for that. This is a virtual CEU event. Here's the contact information for Hartgrove Hospital. List our phone number, our website, and our address, as well as the information for Garfield Park Hospital. And just want to say thank you. And we hope to see you at our CEU event tomorrow, the 18th.
Thank you so much, everyone.
Thank you so much. That was really good information. And I would definitely encourage what we're going to do after we have our second speaker. We're going to open up a couple of breakout rooms, and we'll ask both sets of our speakers to, have that time to, to speak more intimately about their programs and the services that they offered. And you guys will be free to select your own breakout rooms, and you'll have the option to move back and forth. So I want to say thank you all for providing that information. It was really good. Do you have a brochure, or would it be possible to share those slides with the people in attendance?
Yes, we could do that.
Absolutely.
Okay. So that's really good stuff. So thank you again so much for sharing that.
Would you like for us to send that to you and you will share with the group, or?
I can definitely do that. If you send it to Kelsey, I'm sorry, Kelsey, but Kelsey, if you can put your email address in the box for me, please, then you can send that to her, and Kelsey really kind of helps us distribute that information. And when she gives the announcement, she'll also talk a little bit about how we distribute information from other providers. So I would like to invite anyone on the call that wants information to get shared throughout the land, throughout the people that we have on our email list, which is about 300, that you please feel free to share that with Kelsey. Okay. So
Kim, can I just say that thank you for providing the information about the school that is in our district, which is Thornton Fractional High School, District 215. And that is advantageous to the people in the areas that we serve. Thank you.
Thank you. Yes. And so, thank you, ladies. And so our next speaker is Juanita Jenkins from Metropolitan Family Services. And she's going to give us an overview of the R3 program and the services that they're offering, including behavioral health services, case management, job readiness, program, workforce development. And I would like to, yes, thank you. So there you go. Take it away, Juanita.
Good morning, ladies. And can I give a quick shout out to April? Hi, April.
Hey, Miss Juanita, how are you?
Well, there was no ice on the road this morning like they had, said it was going to be. So I am in a great mood this morning. I was nervous as a cat yesterday, but I'm in a great mood this morning. So, so welcome, ladies, and I thank you for having me. I'm here as Metropolitan Family Services employee to talk about the R3 program, which is a grant-based program in its first year at this agency. The proceeds from the cannabis sales, the legal cannabis sales, is what has funded the R3 program. And the whole purpose of the R3 program is to restore, renew, and reinvest in underserved communities. The communities that we are focused on is Blue Island, Robbins, Posen, Dalton, Harvey, and Fort Heights. R3 program goals. So the goals is to expand resources and services to address and reduce service gaps. One of the things that we're hoping to do for those who don't have transportation, life of behavioral health services and counseling, that we will come and meet them where they at in their community. So they don't have to stress or forego services to try to get to agencies. I'm sorry. The communities in particular that was selected have experienced long-term pattern of excessive violence, excessive incarceration, and economic disadvantage. R3 program promotes emotional wellness. We empower individuals and their families, increase economic stability, employment skills, as well as their access to employment through collaborative partnerships. One of the behavioral health component provides individual and group therapeutic counseling services, crisis intervention, and trauma-informed care with participants. Some of the ways we are getting our referrals currently is connecting with the local school districts in the areas that I identified. We did work with Eisenhower High School with implementing a depression screening and was able to get some referrals from there. We are collaborating with the Blue Island Robbins Neighborhood Network to be able to get referrals from the Blue Island Robbins area, but also to provide wraparound services for those community residents. Individual participants are being referred, again, via local school districts, behavioral health screenings, and clients group participation. So currently we are in Calumet Park implementing an anger management group with ceasefire participants in their violence prevention program. And today is our last day. So that program run 12 weeks. Today is their celebration day for participants later on this evening. The therapies we use with behavioral health, individual counseling, and families is CBT, DBT, emotional regulation. We teach them to manage stress. We teach them social skills and life skills, and also in groups. So the behavioral health groups under the R3 program, we are facilitating groups in the communities. I would love to do one at Thornton High School, and that's my son graduated from that high school. So some of the things we are teaching in groups is decision-making skills, anger management strategies, reducing conflict, providing trauma-informed care, social skills, violence prevention, think first, trauma psychoeducational groups. We work to help increase their self-esteem, increase effective communication, and problem-solving skills. R3 program, community navigation. So in this R3 program, we have the behavioral health therapist, which is me. We have a R3 program coordinator, which is Trinice Edmonds. And we have community navigators, case management people, employees, I'm sorry. So the R3 program community navigators are out. We are all out in the community trying to promote the program and increase referrals, but their job is to engage in comprehensive outreach to help identify populations at risk in community areas, identify who are not linked to services and resources. So I did identify like Blue Island, Robbins, Posen, Dalton, Harvey, and Fort Heights, but we're also working with community residents in surrounding communities of those communities also. The community navigators, they help to support residents transitions back into community. So we do have a re-entry portion to this program. We assist them with job placement. Our goal is to reduce trauma exposure and increase capacities for reduced risk taking behaviors and community violence, which we all are aware has been a huge increase since the pandemic started. They also ensure a greater coordination of services, our community navigators. The workforce development piece. Workforce development provide the following to the participants: financial career coaching, resume writing and assistance, intensive case management services, employment assessment and placement, retention support. The job readiness training program is a 16-week training course. And the participants get paid during their participation in that program. And we do help with transportation to the location site. I had mentioned earlier that today is our last group for anger management with the ceasefire participants in Calumet Park, but we will be starting up a new group in Harvey location. And they also help with post-placement financial planning too under workforce development. A part of the R3 program is the Legal Aid Society. So we are contracted with the Legal Aid Society. Our employees, as well as the Legal Aid Society employees, also, we're housed at the Marinette Park location of Metropolitan Family Services off 115th and Kedzie. A part of the legal aid, they're going to provide free services, a part of the R3 program to help participants to access legal services, legal representation, advocacy support, and assist legally in matters of housing, health, employment, immigration, and legal needs of returning citizens. Y'all overlooked my typo error right there. At the bottom of the screen, we do have contact information. In particular, if you have any questions regarding any particular portion of the R3 program. So for Legal Aid Society, Renee Sevilla, that is her contact number. And then I also have Armando Fernandez, that is his email. One of the things that they do is when we're operating groups out into the community, they come out and they give a presentation to the group members, how they can be of service to them. And of course, this service is free. R3 program also have a domestic violence service portion where the domestic violence advocacy services provide crisis intervention, safety planning, and individual and group DV counseling services. They also provide outreach and education within the communities to ensure a direct linkage to needed resources and advocacy supports. The contact name is Jocelyn Cass, and that is her contact number. I'm going to leave it up just in case anyone wants to write that down. So if you have any questions or you want to make a referral to the domestic violence program, she is the contact person. I did mention at the beginning of the presentation, but the R3 program, because it is grant-based, all services to community participants is free. So we don't ask them for any health insurance information, but we do have them complete, if they're in group, a behavioral health screening, just to identify and see if there's any more needs that they need beyond group. For those who are seeking individual therapeutic services and counseling, we implement the IMCANS assessment tool with them. Another part of our R3 program is the Nurse Family Partnership Program, which is also a new program to Metro. I think it's been in operation for 3 going on 4 years. The Nurse Family Partnership Program is a free service to communities. It's the early intervention program geared to provide support, advice, and information for new moms who are pregnant with their very first child. And they must be 28 weeks or less to be enrolled in this program. But it provides a trained nurse who will conduct weekly home visits. Again, they must be a first-time mother from low-income households living below poverty line. Their goal is to empower vulnerable first-time mothers to transform their lives and create better future for themselves and their children. And the contact is Teresa or Kelly, and that is the contact number there. So our R3 program contact information is there on the screen. For me, that is my contact number. Trinice Edmonds, again, she is the program coordinator over the R3 program. So if you have any question in regards to any component part of the program, you can contact her directly, and she will be able to give you the answers that you need. Workforce development would be Craig Blue. That is his contact number. And then workforce development also is Shamika Russell, and then that is her contact number. And that is the end of my presentation. So I am looking forward to the breakout rooms to address any concerns or questions anyone else may have in regards to this program. Thank you very much.
Oh, thank you, Juanita.
Yeah, that was really awesome. I was texting Suzette in the background. I was like, oh my God, this is so awesome. So thank you so much for sharing that. And thank you, Suzette, for bringing such wonderful speakers to the table. You never disappoint. At this point, I do want to open up the breakout rooms, and they're set for about 20 minutes. I know that there's got to be some questions that people have been thinking as you guys have given your presentations. So I'm going to open the breakout rooms. You should see on the bottom of your screen a little icon that says join a breakout room. And once you click on that, there'll be 2 options. One will be for Hartgrove and one will be for the R3 programs. you can go in, you can ask the speakers any direct questions. You will have the ability to come out of that breakout room, come back to the main breakout room, or join another breakout room. But that moving around, you got about 20 minutes, then we'll come back and we'll hear our announcements, and we'll give you the rest of this wonderful Thursday to yourselves, okay? Thank you so much.
Kim, can I just say one thing before we go into the breakout? The program that Juanita spoke about, the Nurse Family Partnership Program, it's coming soon. I am working on having someone to come from Metropolitan Family Services to speak about that program more in depth. So thank you, Juanita, for bringing that up.
And if I could just respond to that, Kelly would be the contact person, so she's the
yes.
nurse.
Okay.
And she's going to be doing a presentation for me at the Blue Island Robbins Neighborhood Network, the Social Emotional Wellness Committee, our next meeting, which is March 2nd. So she's definitely open to doing presentations.
All right, thank you.
Okay.
All right.
All right, cool.
Kelsey, make sure you share with the other lands so they can have these great speakers participate there as well. Thank you again. So the breakout rooms are open. So you guys will be able to join those breakout rooms as well. I will give you the option to the speakers because you are listed as a co-host. If you will be able to record those breakout sessions, that would be completely awesome. And then we can connect on sharing the recording. So I do try to share the meetings on YouTube. That kind of gives everybody an opportunity for other people to hear about your services. And once we come back, I'll ask you to also add your contact information into the chat box. And Kelsey, if you can make sure we're adding that to our database. So that would be great. So the breakout rooms are officially open. Actually, I'm going to close them and then I'm going to open them again so that you'll have your full 20 minutes. Okay. All right.
Before we do, Kim, I got an announcement.
Okay, Kristen, the announcements are going to come at the end. Okay.
Okay.
Thank you. So Anita, you should be going to the R3 breakout room. That's your room.
Okay, I'm trying to get to the room. Where is it? Let's see.
Yeah, let me move you.